Good evening. Can you guys hear me okay?
Yeah.
Awesome. I forgot I had a mic for a second. I was like, okay. So as Kat said, I'm a healthcare policy analyst here at the Ayn Rand Institute. And one of my jobs, main part of my job, is to research and comment on all sorts of government healthcare policies. So Obamacare is a big one right now, right? But I want to talk to you about Obamacare today, not just because it's my job to do so. I want to talk to you about Obamacare because it's a personal issue. What Obamacare is fundamentally about personally affects me. Now, when Obama was running for office the first time around, 2008, I was in college. As Kat mentioned, I was at Penn State, which is in the middle of Pennsylvania. And one of the really remarkable things about Obama's campaign that I witnessed, and it wasn't just me, people talk about it till today, was how well he was able to connect with young people, with people my age, with my friends, with my peers, with what it seemed like everybody on campus. Now, college campuses generally tend to be liberal, so that's not surprising that people were supportive. But this really was something else. Obama's message of change seemed to really resonate. And it was evident. I mean, the night Obama finally got elected, people literally went nuts on campus. Now, I'll tell you, just for context, that Penn State was the #1 party school in America. It's no longer. I'm also no longer there, so make the connection. But it was the #1 party school, so I was used to really loud nights. That's just how things happened at Penn State. You just got used to, if you were trying to study, there's a party going on, you know, if you're not part of it, that's just what it is, every night. But the night Obama got elected, it was something else. It was something else entirely. The whole night, around 20,000 Penn State students, which is around half the population, ran around chanting, "Yes, we can. Yes, we can." That was his slogan, if you don't remember. It's annoying to me. But that's what happened. I mean, it was really clear that Obama had the youth vote. Not just at Penn State, but around the country, all over the country, voters under the age of 30, 66% of them voted for Obama. So people my age, millennials, seem to really believe that Obama was going to bring positive change. He was going to improve our lives, our prospects, our futures. But that's not what happened. What did happen was that since Obama has been elected, the government has passed many, many policies that are actually very bad for my generation. Bad for our futures, bad for our prospects, bad for our lives. And no contest, the biggest one is Obamacare, Obama's signature legislation. Obamacare is a real impediment to people in their 20s, in their early 30s, what they call millennials. What is life about in this stage? I can speak for myself. It's about finishing school, getting a job, going out into the world, exercising your independence, and really try to build the world that you wanted to build, really your whole life, right? It's the first time you're able to go out there and build the life you wanted, to pursue your goals, chase your dreams, try to make it all a reality. Obamacare, as we'll see, is an impediment to all of that. It's a real impediment in our ability, in the ability of millennials, such as myself, such as many of you in the room right now, in our ability to make the most out of our lives. What I want to discuss this evening is two things. First, how Obamacare is doing this, how it's hurting millennials. And second, why is it doing this? Did Obama just have it out for young people, or is something else going on? Now, Obamacare is a huge law, you might have heard. The law itself, almost 1,000 pages. And most of the law is, well, the Secretary of Health and Human Services should decide this, and the Secretary of Health and Human Services should decree that. And so over the last 4 years, Obamacare was passed in 2010, they've been writing pages and pages of regulations. And so really Obamacare is around 20,000 pages. So it really impacts everything in our healthcare system: patients, doctors, drug companies, hospitals, you name it. But the crux of Obamacare, the main scheme, the center of it, has to do with making changes to health insurance. It's about making changes to how health insurance works, particularly for people who don't get their health insurance through their employer. So lots of Americans, most Americans get their health insurance through their employer. Obamacare makes changes to that and impacts that and controls that. But the main scheme has to do with insurance that people are buying on their own. So two big things, part of this scheme, two big things in Obamacare, and I'm sure you've heard of these things. First is that insurance companies, right, are no longer allowed to say no if you apply for coverage. They can't turn people away. So if you want insurance, right, you have to apply. That's generally the process for any type of insurance. And an application means that, some applications can be turned down. So Obamacare says, no, that is no longer allowed. And not only do insurance companies have to offer everybody a policy, if you apply, you're guaranteed a policy by law, but if you happen to be sick, if you happen to have existing medical conditions, pre-existing conditions they call them, you can't be charged any more than a healthy person. So insurance companies have to offer you coverage, and they can't charge you any more if you're sick. The second big part of Obamacare's central scheme is, as I'm sure you've heard, the individual mandate. This is the mandate that requires every American, almost every American, to carry health insurance. And it makes it illegal to not carry health insurance. And it went all the way up to the Supreme Court 2 years ago, and the Supreme Court did uphold it. So the second big part of Obamacare's scheme is that everybody has to buy health insurance, and not just any health insurance, but a very specific kind of health insurance, which we'll talk about. Now, what were they trying to achieve? What was the goal behind these new regulations, these new controls? Well, we were told that, well, look, healthcare is really, really expensive. Health insurance, right, which is how most of us pay for healthcare in this country, that is really, really expensive for people. If you're older, if you're less healthy, if you do have existing medical conditions, it's especially tough. You might get a policy, you might not. If you do, it might be more expensive than you would otherwise prefer. And that makes it hard. And we were told, okay, these people need health insurance and they're not able to get it. They're not able to get it, but they need it. And so what young people need to be doing is paying for this coverage, this health care, this health insurance that older, less healthy Americans want, can't pay for. Young people should be doing it. They shouldn't be paying entirely for older people, but they should be paying a substantial portion of these medical bills, of these medical premiums that some Americans certainly cannot afford right now. So the way Obamacare does this is through insurance. This scheme to get young people to pay for the coverage of older Americans. Obamacare says insurance companies have to administer that. So that's why they can't turn anybody away now. They have to accept everybody, give them coverage. And then the cost of that coverage gets punted to young people. And it gets punted to young people by young people having to be overcharged for their health insurance. Around 18 months ago, there were reports of this phenomenon called rate shock. I don't know if you guys might have heard it. Sometimes I don't know because I'm so plugged into the issues. But it was in all the papers. Because the main provisions of Obamacare, the provisions I talked about, insurance companies can't turn people away, everyone has to buy insurance, all those things went into effect January 1st of this year. So around 18 months ago or so, the rates started coming out, the insurance premiums, because that's what happens. You know, insurance companies release the products and the prices that people are going, that they're going to be offering. And what people noticed right away was premiums for young people, for millennials, for people my age, are 2 times, 3 times, 4 times higher than what they were before. And it was this really big shocker, like, oh my God, what's happening? But this was what Obamacare required. That's how young people are supposed to be paying for the health coverage of older Americans. So normally what happens in insurance? Think about car insurance, right? You're charged according to your risk profile. So if you're somebody who the insurance company thinks, well, you've got a safe driving record, we don't think you're going to get into accidents, you're charged a lower premium than somebody who has a history of dangerous behavior on the road. But Obamacare required that young people be charged higher premiums than their risk profiles would justify, right? Young people, they don't have as many medical expenses. Compare a 20-year-old to a 60-year-old. You have 6 times higher expenses based on your age alone. That's just a fact. So Obamacare requires insurance companies to offer these engineered policies meant to overcharge young people. And the individual mandate fits into this, right? Because the government knew that, okay, if we're trying to get young people to buy this overpriced insurance, what if they just don't? It's not a crazy thing, right? Well, we can't allow that because that's what's happening now. That's the policy. That's what we're doing. So you have to buy insurance. There's not an option. It's illegal now to not buy insurance because otherwise, if not enough young people sign up, and you might remember again from the news several months ago, there was so much fear that not enough young people would sign up. But the thought was, well, we have to make it a law that they, sign up for this scheme in which they're being fleeced for older Americans. So Obamacare is about, at its core, forcing young people to buy overpriced coverage in order to pay for the medical care of older, less healthy Americans. Now, what does Obamacare mean for the people actually paying for this care? For the millennials, like many of you in this room, who are required to pay thousands of dollars more every year in insurance premiums. What does this mean? Well, the fact is, right, that the money that you're earning through your work, and when you're a millennial, most of us are not earning that much, but whatever you're earning is what you need to make the most of your life, to build the life that you've wanted. That's what you need. You need money to make the values you're seeking a reality, to achieve them. And to the degree that the government forces us to spend our money on other things, on things not about building our own lives, but on other goals that the government has, well, to that degree, our ability to achieve our hopes and our dreams is inhibited. All that comes second. What comes first is what the government decides society needs from you. So some of you in this room, talking mainly to the millennials, some of you probably have student loans. I'm fortunate enough not to have student loans, but a lot of my friends do, and I know the responsibility that there is to pay those loans and the pressure there is to pay those loans. Not necessarily pressure from the government, but internal pressure because you want to pay off your debts. So Obamacare says, right, the implication of Obamacare, when Obamacare says, well, young people need to be footing the medical bills of everybody older than them. Obamacare says you're supposed to subordinate that goal of yours, to pay off your student loans, to finally be debt-free, to start saving for other things in your life, things that are important. You have to subordinate that goal. The money you would be using to pay off your student loans, for example, now has to go somewhere else. It's funneled into other people's pockets for their health care. Some of you may dream of being your own boss one day, of starting your own business, of being an entrepreneur. That comes second under Obamacare to paying for other people's medical bills. The money you could be saving for your business to start it it'll take much longer because a lot of your money is now going to Obamacare. There's a front page article in CNN this week talking about how millennials in particular are having more trouble than ever buying homes. Part of the reason is they're not able to save. They're not able to save the down payments required. I mean, I want to buy a home one day, and real estate in Southern California, as I'm sure many of you know, is insane. Obamacare means if you want to save for a down payment on a home, that comes second. All of the pursuits, all of the goals that young people have, that millennials have, want to see another country, want to get a better car, want to move into a safer neighborhood, even something simple like wanting to fly home for Christmas. From Southern California to Pennsylvania, where my family is, it's $650 every Christmas. That's just what it is, and that's not insignificant, right? And then plus another $100 for my dog. You know? Obamacare says to millennials, to hell with your goals, to hell with your dreams, to hell with your priorities, to hell with what you want to do with your life, with the money that you've worked hard to earn. First comes your duty to pay the medical bills of everyone older than you. Obamacare is about the idea that it's built on is sacrifice. Sacrificing the goals, sacrificing the dreams, sacrificing the priorities, the lives of young people. Now, I want to say, when did this become okay? When did it become right, permissible, to view a segment of the population as if their lives are disposable, to treat them like they're beasts of other people's burdens, like they're means to other people's ends? This is supposed to be a country, right, in which each of us has an inalienable right to pursue our own happiness, to pursue our own lives. Inalienable means nothing. Nothing comes before that. Nothing can take importance above that. Nothing can override that right. And Obamacare says, no, you don't have the right, millennials, to pursue your own happiness. Your duty is to sacrifice that pursuit. Sacrifice it for society's needs. And right now, society needs you to be paying the medical bills of everyone older than you. Now, Obamacare's proponents don't exactly stay silent when you say something like this. I talked about rate shock. In the last 18 months, this has been a big issue, and it's been a big controversy. And Obamacare's proponents, the left, really had to defend it because all of a sudden they were being accused of, wait a minute, this looks like it's really bad for young people, at least financially, right? Financially, you can see their premiums are going up a lot. And what they say is, no, this is not sacrifice. This is a made-up criticism. Millennials are not being sacrificed. This is actually good for millennials. Okay, why? It's good for millennials because one day, right, one day they will not be millennials anymore. One day they will grow older. And then they will benefit. They will benefit from everyone younger than them, whatever that generation will be called. From all those people, all those young people sacrificing for today's millennials. So I'm supposed to be assured that, well, maybe my hopes and dreams, okay, they're being sacrificed today, but at least I'll get to do that to some other poor sucker in 30, 40 years. But let me be clear, they do bring up a point. There's a point here to stress. The sacrifice I'm talking about that's being required of millennials is not just a financial sacrifice. It's not an accounting thing. It's not some financial calculus where you can sit back at the end of your life and think, well, how much money did the government force me to spend on things I didn't want, and how much money am I getting in return by forcing other people to give up their money? That's not the issue. It's not the case that, okay, a lot of my income is going now to older Americans. But then when I'm older, if I get back more, right, from the younger generation, that somehow I've won out. Or if I break even, it wasn't a big deal. Right? Because life is, I think, more is not just about what's in your wallet. It's not about your bank balance. So there's this song by Frank Sinatra called My Way. I don't know if all the millennials have heard it, but you should hear it because I like it because it's Frank Sinatra, but it also has a good message. And I love that song because it's about a guy and he's at the end of his life and he's talking about his life and what it was like and the good things that happened and bad things happened and he made mistakes and he learned and he experienced happiness and joy. But he says, what's more important than all of that, what's more important than this, he says, is that I did it my way. That I was making the decisions, that I was deciding for myself what was good for me, what was bad for me. I was thinking about it and I was experiencing life according to my own principles, living according to my own way. And ultimately, that is what we need, right? That is what survival requires. It requires us to use our minds, to think, to decide, to judge, to be left free to do those things, to figure out what's good for us, what's bad for us, to pursue our own happiness. So in the context of healthcare, right, I gave an example of what if you want to start your own business and you want to save up. You're really passionate about it. It's really important to you for you to hit the ground running. You want to start your business as soon as possible. You want to generate the startup funds necessary as soon as possible. You might think for yourself, okay, I don't want to be overpaying for healthcare now with some guarantee that later I'll get it cheaper. I don't want to do that. I'm going to put every cent I can, every cent I have, every cent I earn into saving for my business. And then when I'm older, if they charge me more for healthcare, that's fine. I will deal with that. That's a choice I'm willing to make. That's a trade-off I am willing to make. Obamacare is hostile to that kind of decision making, to you being able to decide for yourself how best to spend your money, on what to spend your money, when to spend your money. So don't let Obamacare's proponents confuse you, because they try and they have to. Obamacare is about sacrificing millennials. Now, why is Obamacare doing this? I want to spend the rest of my time talking about this. Why? Because it's not like there's some vendetta against millennials. It's not like people are out to get people of my generation, that people are trying to make life difficult for us. Millennials are not really being singled out. They're being singled out in Obamacare, but they're not being singled out in the if you think about it more broadly. There's a principle at stake here. There's a principle that Obamacare's proponents were acting on. Quite simply, it is that sacrifice is the name of the game in American healthcare. It's what the government has been doing for the last 50 years when it comes to American healthcare policy. It's been all about forcing some people to sacrifice for other people's. Right now, it's about young people being sacrificed, millennials being sacrificed. But it's what the government has been doing. It's what's been happening in our healthcare system for the last at least 50 years. That individuals have been forced to sacrifice their income, which means their ability to pursue their values, achieve their happiness, chase their dreams. That's been happening for the last 50 years. But sacrificing all of that to the medical needs of others. That's really the goal. It's been the goal. It's not Obamacare. Obamacare is not isolated. Now, another name for that goal, or another way to think about it, is that's socialized medicine, right? That's the end goal. That is the goal that the progressive left has had in the United States over the last 100 years. And they've been working toward it slowly, incrementally. And Obamacare is just the latest way they're making good on the notion that socialized medicine is based on, which is you're your brother's healthcare keeper. You're your brother's healthcare provider, your neighbor's healthcare provider, whoever they say, doesn't matter. You're his healthcare provider. That if your neighbor needs healthcare and he cannot afford it, he cannot get it, it's your responsibility now to sacrifice your own desires, drop everything, pay for his healthcare. That's what the government's been doing for the last 50 years, trying to make good on that vision. Trying to make good on the vision of implementing and enforcing the vision that people are sacrificing the pursuit of their own happiness for the needs of others. And I think we can name just a few examples, right? I say 50 years because next year will be the 50th anniversary of Medicare and Medicaid, two huge government programs, right? Medicare, which pays for the health care of seniors, people over 65, and Medicaid, which pays for the health care of lower income Americans. It was the same principle that was used to pass these policies. Lyndon Johnson said, Americans over the age of 65 want medical care, and some of them are not getting it right now. So it's the responsibility of everyone else, of everyone under 65, to sacrifice their own interests and provide seniors with this care. That's what you have to do, they said. And that's what Medicare does. It seizes a significant portion of the income of people under 65, and it uses it to pay for the health care of people over 65. Now, I know some of you are thinking, that's not Medicare. I earned Medicare. You can ask me about that in Q&A, but no, you didn't. That's the short answer. And it's not just, the government's not just hell-bent on getting certain age groups to sacrifice for each other, like millennials to people older than them, under 65, or under 65s to everyone over 65. It's not just that. It's all sorts of different demographics, all sorts of different ways. The principle is more broadly, individuals are being sacrificed. So Medicaid does not sacrifice based on age, but it's everyone over a certain income now has a responsibility to pay for the medical care of everyone under a certain income level. And that income level has changed over time. I said Obamacare was about making changes to health insurance that people get outside of their work. So if your employer does not provide you coverage, Obamacare has made changes to you getting insurance, buying coverage on what they call the individual market. But if you get your health insurance through your employer, which most Americans do, I think 190 million almost Americans do, well, then that scheme of young people having to overpay for older people has been there for years. Government has required it for years. Yaron Brooks sometimes likes to joke, like, haha, you're paying for my medical care. But it's true. So different age groups, the government says, have to be sacrificed to each other. Income levels. Users to non-users. If you're using medical care, non-users have to subsidize you, have to pay for it. So you've heard of maybe these things, well, the contraception mandate, right? This is going to be ruled on by the Supreme Court, requiring everyone to buy coverage for contraception. There's a whole bunch of services that Obamacare requires you buy coverage for, and it's gone on before Obamacare. The states have been doing it for 50, 60 years, and there were over 2,000 mandates required in effect before Obamacare. So men were forced to buy coverage for birth control, not because they need it, but because to subsidize the women who do use it, right? Bachelors required to buy coverage for in vitro fertilization. If you don't drink, you have to buy coverage for alcohol rehabilitation. If your kids are grown, you have to buy coverage for pediatric care. So sacrifice is the name of the game in American healthcare, and it's been that way for a very, very long time. Now here's what I think needs to be asked when we're evaluating Obamacare. What has been the result? What has been the result of this principle that has been driving government regulation over the last at least 50 years? The principle that people's healthcare needs entitle them to what's in someone else's wallet. You can't pay for your healthcare, well, the other guy has to. You're entitled to it. If you asked this question before Obamacare was passed, your answer would have to be, if you were looking at reality, is, well, the result has to be the status quo before Obamacare. Because most of the regulations we had in healthcare were trying to bring about this outcome, trying to bring about a system in which incrementally more and more you are your neighbor's healthcare provider. And the result was the status quo before Obamacare, which was not that great. The whole reason we needed Obamacare was because things were so bad, apparently, right? I mean, health insurance, if you didn't get it through your employer, if you did get it on the individual market, it was not always a pleasant experience. More broadly, healthcare was so bureaucratic. Costs kept going up and up and up for everybody. It was not a great place. And all of these people who had genuine problems before Obamacare, people had genuine problems before Obamacare. It was true that health insurance was ridiculously expensive and the cost kept rising continually, unlike any other insurance products. You know, it was true that you lost your job, you lost your coverage. That's annoying. Why did that happen? It was true there's a lot of people out there walking around without insurance, and you had to wonder, insurance is a pretty good thing. Why don't they have insurance? I mean, this was a system in which all these people who were having problems, genuine problems, right? Over the last 50 years, incrementally, all of these people, their income, their choices that come with being able to spend your income the way you want it, on your health care, what kind of services you want, how you want that care, how you want to arrange for it over the long term, all of that had been sacrificed. All of that had been sacrificed in the name of the principle driving us towards socialized medicine. So just take one small example. There are so many uninsured people before Obamacare. Well, it turns out that 1 out of 4 uninsured before Obamacare said they wanted insurance, but the only option was either by really, really expensive coverage for all sorts of services that you don't want or need, like birth control and in vitro and rehab and all sorts of things, or you can't get any coverage at all. That's the way the government has set up the system. So you were expected to sacrifice, and now all these people are like, I'm not paying for this. I can't pay for this. This is not a good deal. What's the choice we faced before Obamacare? The choice was we continue down the path that we're on. We continue down a horrific path, a horrific system, right, which treats each individual's life as fodder for society's needs. That's how millennials are being treated. That's how all Americans have been treated. Most Americans have been treated before Obamacare when it comes to health care. Do we continue that system? Or do we challenge the idea? Challenge the idea that has led us to this state, to this status quo that nobody is happy with? Do we challenge that idea and try to move towards a system, right, in which people aren't treated as means to other people's ends, where they're free to pursue their own lives, their own happiness, the health care that they think is good for them, a system in which nobody is sacrificed? That was the choice. Do we continue down this path, or do we take a hard look at what got us here, and if whatever got us here can't be good because it led to the status quo before Obamacare? And the decision was, no, we are going to continue. We are going to double down on what we've been doing. And in this context, doubling down means we have to find fresh victims. We have to find people whose pockets have not been bled dry yet. Find them, herd them, rope them in. The new victims, the victims that they found, are the millennials. And I say millennials this whole time, and that's broad, but really I mean young people who don't have insurance through their employer, right? Because if you have insurance through your employer, you're already being fleeced to pay for older people's medical care. But millennials who are getting insurance on their own on the individual market, or they don't have insurance at all. They're choosing to go uninsured, right? And you can't be uninsured because then you're not part of the redistribution scheme that the government is trying to administer through insurance. So it was a specific kind of millennial. Those were the victims that they found, that these people are not being sacrificed, and sacrifice is the name of the game, so we better rope them in. People say all the time that Obamacare's rollout was rocky. We'll give you that. The law has 1,000,001 implementation problems. Don't give it any of your personal information, the website. You will be it'll go to somebody in Nigeria. It's true. It's not making it up. But that the law is good. The left says this. The Obamacare's proponents say this. The law is fundamentally good. What it's trying to do is good. You can't throw out the baby with the bathwater. We agree. It would have been great if we could have made this a little bit smoother. But the goal is good. The intentions behind this law are good. But Obamacare, there's nothing about the law that is good, that is motivated by good intentions. Obamacare is about perpetuating the injustice that has plagued American healthcare. Millions of Americans before Obamacare had their choices, had their income, had their ability to make the most out of their lives sacrificed. And Obamacare said, we haven't sacrificed enough. We need to find new victims to sacrifice. And they found millennials, those of us who are just starting to build our lives. But it won't achieve what they're trying. It won't bring some sort of utopia, right? The only thing mass slaughter can achieve is death, mass death. And that's the road that we've been heading on. Death of the quality of our medical care. It's no doubt American healthcare right now has the best quality compared to other countries. But it is not going to stay that way. It's already not staying that way. Death in our ability to pursue healthcare according to our own judgment. Buy the kind of coverage that we want to buy. Plan for our medical care the way we think it should be planned for. Death of our choices. Death of our ability to pursue our own lives. And this is not made up. I mean, you go to countries that are further down our path, that have achieved full-scale socialization of their medical care, and you see death. I went to Canada 2 months ago, March, to speak to a group there. And one of the really interesting things was that I've grown up in America most of my life. You hear about Canada. There's a lot of obsession with Canada and how Canadians are doing, and are they doing it right, and should we try to be like them, and we have this fetish with Canada. And I went there and I thought, okay, well, everyone says that there's horror stories in Canada, but they have to be horror stories. They have to be the exception. Things are not that bad. And what was most eye-opening for me was, no, we're not hearing horror stories in the United States. This is routine. It is routine for people there to die waiting on waiting lists. It is routine to have to wait months and months and months in agony for basic procedures. It's routine to have to wait 2 years to get an MRI. That's just the way things are. That's the path we've been heading down. So nothing about this law was motivated by doing good, about taking responsibility, about taking a hard look at how we got to where we were before Obamacare, and actually fixing the problem. What American healthcare needed before Obamacare was to be deregulated, for the sacrificial programs in place, for those to be repealed, to be ended, to be phased out. What we needed was to move towards a system of freedom, to hold the free market as the ideal, not holding the ideal as massive sacrifice. Now, there's a lot to say about a free market, and there's a lot to say about what healthcare would look like and everything like that under a free market. But the key characteristic of a free market, the reason I say it's the ideal, is because the virtue of the free market is that nobody is sacrificed. Nobody's forced to sacrifice. People are left free. They're left free to pursue win-win relationships. If you think somebody's offering you an insurance policy that's not a great deal for you, you don't have to buy it. You can go and seek greener pastures. If you're paying for someone else's medical bills, if you're helping somebody out, it's because you want to do it, because you decide, yeah, my life is better if I help this person get on my feet. Free market is about people being able to pursue their own lives. But instead, what we got was Obamacare. Instead, what we got were fresh victims. The greatest tragedy as I see it, particularly because I am a millennial, is that young people today, people my age, still don't see Obamacare for what it is. It wasn't that obvious when the law was first being debated, when they were first talking about it. Just speaking for myself, I was really interested in healthcare issues. I followed the Obamacare debate while I was at Penn State, but I didn't really understand what the heck the law had in it, and then apparently nobody else did either, right? Because you had to pass it to find out what was in it, which by itself should suggest how irresponsible it was. But now we know what's in it. Now things are clear. Since last summer, I bet none of you have escaped an Obamacare ad. And these ads are very specific. These ads are targeted toward people my generation. Everywhere I went, I saw an ad making Obamacare look cool, making it look like, look, all the celebrities tell me to sign up for it, and the NFL says to sign up for it, and Ryan Seacrest says it, so what more could it be? These were attempts to try to convince young people, because they were so scared, even though they made a law saying it's illegal to not buy insurance, they still thought people would not buy it. These were all attempts to convince people my age to sign up for their own slaughter, to make it sound cool, like that's not what's happening. If you're a millennial like me, you should be up in arms about this. You should be out on the streets. This time not cheering for Obama, not cheering for Obamacare, but speaking out against this injustice being done to you. Before Obamacare, people did not speak up enough about this. They did not point out the injustices enough. Some people did. It wasn't loud enough. They weren't heard. Silence today is not an option, I think, for millennials. We have to be declaring with moral confidence, that our lives are not disposable, that we refuse to be victimized, to be sacrificed, to be exploited, to continue an unjust practice that's been plaguing American healthcare. That any law that views us as pockets to loot, as lambs to sacrifice, it's a law that is immoral, it is un-American, and we will not stand for it. Thank you.
Yeah, yeah.